afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy you chose to spend this hour with us, and we are looking forward to a very critical discussion about a very critical issue regarding our health. Without further ado, I will turn it over to our founder, Dr. Randall Maxey.
Good afternoon, everyone. Dr. Barbara Neighbor Stevens, Dr. Ivan Walsh, Dr. Hines, Dr. Lawson, and Simon, and all of our invited guests. Let's go to the first slide. I did go to church today, Dr. Walsh, and they let me sit on the front row instead of the second row. And we were in the process of conducting a health fair on our parking lot.
Nice. Okay.
And exactly next to the church is a dialysis center. And we want to talk about how to stay off of dialysis. There's something called chronic kidney disease, and we want everyone to pay attention because this is something you need to know about because you may not know about it. Next
Dr.
slide.
Walks, your sound is kind of wonky.
My sound?
No, Dr. Walks' sound.
My sound?
Yeah, you're far away.
Okay, I will speak up. Thank you.
That's not it.
Isn't that good? All right,
So we want to talk about life-saving facts that everybody should know. Let's go to the next slide, Simon. So, Barbara, you want to read this one?
Why kidney health matters. Kidneys filter toxins and excess fluid from the body. It helps to control the blood pressure. It helps to maintain the chemical balance in our bloodstream known as electrolytes. It supports red blood cell production.
Next slide. So, it's a silent epidemic. It's like hypertension. You may not know you have it. And we know that more than 37 million Americans have CKD, chronic kidney disease. Most people do not know they have it. In the early stages, it has no symptoms. It's silent like high blood pressure. But early testing can prevent you getting on dialysis. Next slide. Dr. Walks?
Let me see if my sound is working okay today.
It is not.
You still not able to hear me?
We
There.
can hear you. It's just not crisp. It's kind of muffled, but you can read and we can hear you.
I'll speak up. 10 things every patient must know about their kidneys. Kidneys filter about 50 gallons of blood daily. Kidney disease may have no symptoms early. A simple blood and urine test can detect chronic kidney disease. Diabetes and high blood pressure cause most cases. Protein in urine is an early warning sign. CKD increases risk of heart attack and stroke. Early treatment can slow kidney damage. Healthy lifestyle protects kidney function. Certain medications protect kidneys. Knowing your kidney numbers can save your life.
Thank you. Next slide. Dr. Hines?
EMR alert system for chronic kidney disease or CKD. The automatic eGFR calculation that's going to show up on your lab panel, and it'll alert if the eGFR is less than 60. It'll alert if the ACR is abnormal and triggering chronic kidney disease staging and referral guidance.
You want to explain eGFR?
The expert can do it.
It's the estimated glomerular filtration rate. It's the creatinine clearance. It's how well the kidneys are functioning. And we say that you have a lower kidney function or CKD if that number is lower than 60. But actually, if it's lower than 90, it really may have early showing. And ACR is albumin creatinine ratio. That's the amount of protein that is in your urine, measured in micrograms per minute. And we know that there's critical staging of the way CKD goes. And we have some slides on that. Next slide. Let's take this from Dr. Hines.
What do kidneys do? So your kidneys remove the toxins from your blood. They are also responsible for balancing your fluids, regulating your blood pressure, as well as producing several different types of hormones.
Next slide.
So what is
Uh,
chronic?
Go ahead.
So what is chronic kidney disease? It is the gradual loss of kidney function, and it develops over months or years, and it is often silent in its early stages. It may only be seen on lab tests in its early stages.
Tell me when Dr. Lawson on. Next slide.
He's
He's
on.
on.
Dr. Lawson, is he unmuted?
He is not unmuted yet.
Go ahead, Dr. Hines. Do this one too.
So stages of chronic kidney disease. So stage 1 and 2 are when you have mild damage. Stage 3 is moderate damage, and stage 4 to 5 is severe kidney failure.
Okay, next slide. Okay, Dr. Neighbor Stevens.
Major causes of chronic kidney disease: diabetes, high blood pressure, autoimmune diseases, and making up a very small percent genetic disorders.
Okay, let's take the next one too.
Chronic kidney disease awareness. We have a pie here where we have the orange section is chronic kidney disease that people are not aware of. And we have a blue slice, which is 10% who are aware of their chronic kidney disease.
Next slide.
Leading causes of chronic kidney disease. Diabetes is the champion, followed up closely by hypertension, and in a tie with other causes.
Okay, next slide.
Kidney function decline over time. Disease progression.
What this really shows is that over time you do get kidney failure if you do nothing. And by treating it appropriately, you can get rid of almost 100% of it. Another slide will show that. But if you do nothing, you definitely will head to kidney failure or need a transplant or be on dialysis. Next slide.
Cost of kidney failure versus prevention. This is a very dramatic slide for those who know someone who has been on dialysis or they're heading toward dialysis. This is the overwhelming cost driver in the care of kidney failure, dialysis. Early chronic kidney disease care is very small compared to the overall cost of dialysis. And
The
of
overall
course,
cost,
preventing it, you don't have any cost.
overall cost of dialysis might be $100,000 to $120,000 per patient per year. Whereas to take the test that it takes to prevent it, you may take it only a couple of $1,000s. So big difference. Next slide.
Dr.
And-
Maxey, just
Yes.
want to know, the slide is actually incomplete. There's another cost. What is the cost of a human life?
Good point. Good point. Good point. And the average dialysis patient has a lifespan of roughly 8 years once you get on dialysis, and that's barring. And usually, kidney disease doesn't kill you. What kills you is either heart disease, a stroke, or infection. So kidney disease just sets you up for something else to kill you. Take the next slide, will you, Dr. Lawson?
Medications that slow chronic kidney disease progression, and I can't read this, is ARB, is CLTC, phenytoin, and GLP-1.
So it's important, those ARBs, those are foundational. Everybody should be on a ARB. and that helps lower the pressure inside the glomeruli. The other drugs are ancillary to it, but foundational has to be those ARBs, the losartan, lisinopril, and those types of drugs. Next slide. Go ahead, Dr. Lawson.
Who is at risk? Diabetes, again, hypertension, yeah. Family history, it's maybe related to those two, and age over 60.
So Dr. Hines, that means you're not at risk yet. Next slide. I always tease her about her youth.
Hanging in there.
You know, Dr. Maxey, I don't want to be anecdotal, and I also don't want to put you on the spot, but what percent would you estimate the population of people on dialysis that are under the age of 50 or even 40?
I don't know that number off the top of my head, but it's
The
not.
reason I'm asking is that I see an awful lot of people on dialysis in my work that are under the age of 50. And every time I see one, I just shake my head.
Well, being a pediatrician, you would probably see that. But we do have a whole different set of pediatric dialysis centers that specialize in dialysis of children under the age of 20. So it
These
is,
are adults that I'm seeing in
Yeah.
my work.
but
I have some numbers for you if you'd like.
go ahead.
So according to the United States Renal Data System, let's see here, 20 to 25% of dialysis patients in the US are under the age of 50, and that breakdown is between 18 to 44, about 10 to 15%, 45 to 64 is 35 to 40%, and 65 plus is 45 to 50%. So the
Interesting.
largest group is clearly those over 65. But to your point, the 45 to 64-year-olds are not that far behind.
And another group that fits into that, Dr. Hines, are those people who have a family history of APOL1. There's 12% of the U.S. population, Black population, that has that kidney disease from a genetic mutation. And if they get HIV, if they get diabetes, if they get hypertension, or if they get stress, they can have kidney failure based upon that. So family history is very important. Next slide.
While we're transitioning, the other thing it also says is that younger people are more likely to receive transplants, which also plays into the reason why the stat distribution specifically for dialysis would end up kind of how it does, not necessarily that they didn't have issues that led to end-stage renal disease. They just got a treatment that older people don't necessarily get.
Okay.
Hmm.
That's neighbor two on this one.
Early warning signs: fatigue, swelling of legs or ankles, or both, foamy urine, and frequent urination at night.
Next slide. Dr. Wilkes.
Advanced symptoms: shortness of breath, persistent nausea, loss of appetite, and confusion.
Next slide.
Why CKD is dangerous? It increases cardiovascular risk, can lead to dialysis, and CKD is associated with stroke.
Okay. Dr. Hines, next one.
Life-saving test, blood test, so you can get that EGFR, a urine test to get that ACR or albumin creatinine ratio, and blood pressure measurements.
Okay. So that urine test is especially important, and your doctor has to order it. It's just simple to do, but most doctors, unfortunately, don't know to do it. So we need to get that out there to the family practitioners and primary care doctors. Let's look at this one again. This is just to repeat. Let's skip it. Dr. Lawson?
How chronic kidney disease progresses. Damage accumulates slowly, often silent early. Early treatment slows progression.
Next slide.
Lifetime protection. Healthy diet, exercise regularly, maintain healthy weight, and limit salt. I guess they're presuming sodium.
Yeah. Black people eat too much salt, right? Next slide.
Right.
Dr. Lawson, take this one.
Monitor blood.
Go ahead.
Monitor blood pressure regularly. And I hope everyone saw that study showing that only about that big study showing only about a third of people will monitor their blood pressure regularly. You weren't told they must do this. So take medications. Medications don't work if you don't take them. Lifestyle changes. And lifestyle doesn't work if you don't do anything but sit up and become a couch potato.
I have a friend in Guam, Dr. Walsh. He goes to church every Sunday, but he doesn't get out of the car. He just drives around the church and block and goes back home. That's his church. Next slide.
Dr. Maxey, we got to work on your friend group. We'll work on that.
Next slide.
Control diabetes. Monitor your glucose. And as Dr. Lawson just said, medication doesn't work if you don't take it. And take it when you're supposed to take it. If you're supposed to take it twice a day, don't take it once a day. And act like you're taking it. So,
You can't just put
medication adherence. I'm sorry, Dr. Maxey?
Just can't put the pill bottle by your pillow? You have to take it?
No, don't just take it with you or take it near you. Put it inside of your body, along with a healthy diet.
Next slide.
I just want to note the term adherence. Taking 4 tablets at night to make up for the 4 days you didn't take it. It's not good medical adherence.
That's Neighbor Stevens.
Kidney protective medications, ACE inhibitors, ARBs, SGLT2 inhibitors, and finerenone in selected patients.
Okay, next slide. Dr. Hines.
Avoid kidney toxins. So limit your NSAIDs. That's your ibuprofens and your Advils and things like that. Avoid dehydration and be cautious with supplements.
Next slide.
A healthy kidney diet. So you want to reduce your sodium, have a balanced protein intake, and eat fruits and vegetables. And I think that balanced protein intake is a really good point to keep in, because people, the discourse around protein is huge right now. So a balanced protein intake is important.
There's an interesting thing about the protein. At a certain stage in CKD, protein becomes potentially toxic. But we also know you need protein to keep your muscle mass up, which helps lower your spikes in your glucose. And we also know that just eating protein alone without using something that puts it into your muscle, it requires something called leucine. And that's contained in eggs, in the egg whites, and also, what's the stuff we use? I can't think of the name of it. What's the name of
What
this?
do you use it for?
I'm trying to, yogurt.
Yogurt.
And also legumes. They have leucine to help the protein incorporate itself into your muscle. But you have to limit your protein, especially meat protein, So when a person hits stage 3 or 4, I usually prescribe a diet of no more than 80 grams of protein per 24 hours. Next slide.
Dr. Maxey, just want to note, I just had experience of, I just got several bags sent from me, stating help your muscle mass. And I've talked to several other people who are receiving them. These are so-called protein enhancers, big blobs of just straight, whatever they get their protein source from. As far as I know, it could be almost toxic in terms of the degree to which they're enhanced.
Yeah, that's why I write that diet: 2 grams sodium, 2 grams potassium, 80 grams protein. That will limit the amount of protein that you take in and won't be as toxic. Next slide. Dr. Neighbor-Stevens?
Screening prevention, community prevention, screening programs, these health buses and other events that sometimes are held as health fairs or at other events, education and public health initiatives.
Take next slide too.
Key takeaways: know your kidney numbers, get tested early, control diabetes and blood pressure, and healthy lifestyle.
I think that's it. Next slide. That should be it.
Dr. Maxey, and the point I always made before, for whatever reason, people in the mental health system or the correctional system just do not end up in a situation in which this is care. And those populations, very high rates of kidney disease.
Okay, thank you. Thank you. So do we have anything in the chat? No questions or comments?
Dr. Gibson had a point. How would amino acids and other supplements be used to manage protein balance?
Separately, unmute him. Dr. Gibson,
Yes,
how are you, sir?
I'm doing well. Thank you, sir. I'm just curious to know what would be a proper approach. Earlier, it was mentioned that protein intake needs to be balanced. I suspect that that would involve perhaps amino acids and other supplements, but I need guidance on the proper proportion of same.
Okay, first of all, I would tend to stay away from supplements. So use the protein, whether it be meat, whether it be legumes, whether it be beans, yogurt, something that you can measure and you know what's in it. Why use a supplement when you're eating real food? And the portions of a piece of fish, for example, or a turkey burger might be a palm-sized piece. It would be roughly 80 grams of protein, but I would not go with supplements at all.
Well, I guess that's where you and I differ. I mean, I wouldn't try it at home, but for one that might be a little more familiar with quantification and measurement of milligrams and such, it might be safe for those people. I guess that would be healthcare professionals, trained healthcare professionals. But
let's discuss about why would you eat a supplement as opposed to eating food?
I didn't say as opposed to. I didn't say as opposed to. I mentioned management of protein, right? So, that means quantifying the amount of protein you have in your foods, the whole foods, as well as, possible supplements. I have personally, full disclosure, used supplementation successfully for decades. So I personally have no problems with it. It's been okay in my workups, but say more.
So I gave a talk last week on this process of regular patients from a public health standpoint. And most people are not sophisticated enough to adequately eat using just supplements. So it's better for the general public, which includes people like me, to eat your piece of meat, to eat your fish, or to eat your plant-based protein. Supplement with something that has loose in it, whether it be yogurt or whatnot, and not fool around with supplements where most people could not judge how much protein they're getting. So if you have a dietitian who wants to put you on a supplement, that would be fine. But I personally don't recommend that.
Dr.
Thank
Mack,
you.
let me just reinforce your point. The problem, it relates to that other problem, and that is that there's so few grocery stores and something other than convenience stores that supply food that people do end up having relative malnutrition. And they learn from their own empirical use that if they're short of stuff, just eat a lot of it, especially if it's in supplement form. They often learn discouraged from eating natural food because it's expensive and because, frankly, it's unavailable in even our wealthiest African American communities.
You know, I have a similar caution against a lot of people drink fruit juice. And I know that it's better to eat the fruit than just the fruit juice. And I know Dr. Neighbor Stevens has said with babies, you don't want to load them up with juice, but feed them fruit. And that lowers the rise in your blood glucose. We want to speak about that a minute, Dr. Neighbor Stevens?
Well, parents are well-intentioned in what they're doing. They're trying to give the child, they think fruit is important, so they think fruit juice is a good alternative to it, not recognizing the astronomical sugar content of fruit juice as opposed to the whole fruit. And the other thing is, and so they think that that's fruit juice is a healthy snack, and it's not a healthy snack. And sometimes it's used as a treat, but more often than not, it's just an attempt to try to give them a balanced diet. So what we ask is that if you're trying to give your child, keep your child hydrated, just give them water. Just give them water. They don't need fruit juice for hydration. Just give them water. And if they're old enough to eat fruit, then give them fruit rather than the juice.
And let me raise this question to my co-moderators too.
Yeah, Dr. Maxey, I just want to make one quick point. And that is, we're talking about the youth, but also the elderly. Many people are ending up in supported living facilities, nursing homes, and so forth. And many of these facilities, they say they cut costs by providing these unrealistic diets, high in supplements, high in juices, which basically keep people alive, but really does not promote health. And I guess to work on this, something can die anyhow, so what the heck?
Let me start some debate on here, man. I'm against this stuff people drink called alkaline water. And people drink alkaline water and say that's gonna make you healthy. Let's discuss that a minute. Pros and cons. Anybody want to take off on that?
I don't think I've heard of it.
So I've heard of it. So I'll tell you the context in which I've heard of it. I've heard of it from a lot of people who, in the space of like to keep cancers away or help people who are in cancer recovery and various forms of like to Dr. Maxey's point, it's supposed to make you healthier. They sell it at the grocery, like they sell it all around. It's bottled water. It's just water that has a higher pH than your standard water. There is some rationale behind why they think that the elevated pH is better. And it has something to do with something like creating an environment like that tumor cells don't want to thrive in. I think I didn't retain the details because it doesn't necessarily make sense to me, right? Because your body's going to balance out whatever you put in there anyway. So I don't think I retained, but that's kind of the thought process around it. And some people they sell alkaline water pitchers so that you can, turn your regular water into alkaline water. It's a whole
Whole thing.
thing.
Yeah,
Let
well,
me, let me just note that a lot is also see a lot is among athletes, ex-athletes. The idea is that chronic exercise produces a lot of ketoacidosis and so forth, and so you need to add alkaline to bring down your to increase your pH to offset the toxicity from exercising too much. But I see people who do not exercise, who see themselves as athletes, drinking this. And there have been reported deaths of athletes who overtrain and who try to use stuff like this.
yeah. So alkaline water, from my standpoint as a nephrologist, is basically BS. It doesn't do anything. Your body has so many what they call balancers of your pH that it cannot change your pH at all. So it's really a waste of money. I mean, if you want to drink it just because it satisfies you mentally, go ahead. But it's an extra cost for nothing. Like Barbara Neighbor said, drink water. Plain old water is good. Now, you might want to distill it or filter it and get anything out like that you want, but alkaline water has no physiological significance that will help you at all.
I
Can
think
I,
Dr.
can I
Lawson's
step into the water debate for a moment?
Yes.
So Dr. Neighbor Stevens made a very important point about parents giving juice to kids as a treat and what have you. It's important that we train ourselves to like the things that we're supposed to like. If you can get babies to drink water and then get toddlers to keep drinking water, and by the time you get to be a little bit less young, like me, I don't like, look at Dr. Neighbor Stevens showing off right now drinking some water. I don't like the taste of water. So people start trying to put all kinds of stuff in their water because they're not used to drinking it. So I think it's really important to encourage young people to develop a taste for water so they don't wind up saying, I don't like the taste of that. It don't taste like anything. So these are habits we develop, and we encourage and nourish these habits. Other comment real quick. In the chat, there was a question about juicing, or a comment about juicing versus juice that you buy. I had a good friend of mine that went out and spent a whole bunch of money on a juicer and was juicing up everything. And I'm like, come on, just eat the stuff that you're juicing.
Good point.
But there's something to be said to your point about preferences, right? People have different textures that they like. Like, what if in my juicer, my dad went through a whole juicing phase for a while. He had the most interesting trash. But at the same time, the variety of things that he was putting into his juicing things was not the same vegetables that he was cooking for dinner. Right. So he was getting a whole other set of nutrients, right? And variety, because you put some of these things that you put together, they don't on their own. I don't know that I would be, consuming kale. I don't mind kale, but I'm just using that as an example. But, you can put it in your juice and make it taste good with some other stuff. And then you've got a whole new set of vitamins and things like that people like. You'd be surprised. People feel strongly about things with seeds and whether or not it crunches, and I don't like it if it's mushy, and all of those other things that might keep you from enjoying fruits and vegetables in their natural state. And especially at the grocery store, sometimes it's hard to find things that are ripe in the right way, right? To make it, I like plums, but I like my plums a certain way, right? I like them firm and sweet. If they're mushy, I don't want it. If it's like, so all of those things, sometimes I think, when striving for perfection, we might miss the opportunity to just do better, right? And a lot of people who are juicing, they're doing better, right?
That's a good point. That's a good point. And you're juicing, you want to try to make sure you get fiber in it. You want to make sure you don't have a lot of sugar in it. But juicing, which can be mashing up something good, there's nothing wrong with that itself. But be careful about that sugar. That's my real concern about people who deal with juice. But the way she's talking about it, that makes a lot of sense.
Yeah,
Now,
but
Everything
we
Dr.
should
Hines
be
talked about makes a lot of sense.
there's some
Just
chance.
listen to her, you'll be fine.
we should also be concerned. A lot of people buy juice products like kale juice, green juice in these convenience stores, and a lot of that's being recalled because of listeria and other things that happen with things you buy commercially. But she's talking about when people have a juicing machine at home to extract it, and that's good. I remember one time I cut a piece of ginger up in my juice, and it almost killed me with heat. Ginger is it's hot as pepper, but it made me feel good. Made me feel good. Any other comments or questions in the chat?
I had a comment when we were talking about protein and protein supplements and that type of thing. And Dr. Lawson kind of hit on it a little bit when we were talking about alkaline water. And I'm in this new wellness phase that apparently we are in the socials world, whether you like it or not. Like all the commercials are coming at you with different supplements and stuff. Some of these things and the protein powders and all the rest of that, all these protein supplements are for people potentially who are doing exercise regimens and that kind of thing, where you are needing that level of protein to build muscle. The reality is the majority of us are sitting on our behinds most of the day, right? So we are not burning or trying to build the level of muscle that we can't, to Dr. Maxey's point, eat our way through, right? Now, if you're Michael Phelps or you are some, high performance athlete or those kinds of things, then sure, you may not be able to eat your way, to and through some of those things. But there's a lot being marketed to people that under the guise of this is good for you. And on our slide, we have the word balanced protein. And I think that balance part can get lost when to the points that were already made. You may not know what balanced actually looks like, but there's a lot of protein being pushed towards people like it is the best thing you can do is just have more protein.
Dr. Max just note that as a former high level athlete and ex-judo champion, seen a lot of cases in which so-called great athletes either almost killed themselves or did kill themselves from inappropriate use of supplements, as well as high protein, so-called electrolyte balancing, and so forth. And many times these coaches themselves are not nutritionists, do not bring in the dietitians, do not bring in physicians only when the person is semi-comatose. So we still have a lot of cases in which people who are otherwise healthy because they're trying to reach some sort of peak athletic performance think that they can eat or drink themselves to high successful performance.
And the other
So I
thing that
want to jump on this too, because in the umbrella over all of this, and it just annoys me so much, there are so many self-proclaimed experts on social media and regular media pushing everything under the sun. And you need to know the validity of the claims that they are making before you put it in your body.
that's a real good point, Doctor. What I want to comment on, and when I was in medical school, and most of us of our age, we did not really get taught nutrition. We left it to the nutritionists. Maybe in Dr. Hines' days, they taught nutrition, but most physicians and most providers are not experts at what really nutrition is. I think we need to up the game on the wherewithal of what really nutrition is and how it fits into your metabolism. So maybe one of the shows we'll bring on some nutritionally trained providers to give us more in-depth information, because we are being scammed a lot with all this money-making stuff that we don't know not as much about as we should. But I'm still against alkaline water.
So, before we leave this, Dr. Maxey, let me say that when we do, because by now we've been doing Black Health Trust for a little while now. So by now everybody knows that they should have a primary care provider, right?
Mhm.
If you don't have one, Dr. Maxey is going to come and beat you up. You got to have somebody who's regularly checking on you. And a lot of times people will come in and the question will be, well, are you taking any other medication? And they may say what their prescriptions are, but they won't say that they're taking other non-prescription medication. And then to pile on top of that, they won't say that they just started this diet they saw on TikTok where all they're eating is candy corn. I don't know. I would not be surprised if that is not a recommended diet someplace on TikTok, because people recommend everything, and the more outrageous it is, the more people are going to go, oh, that must be something that I should try because I've never heard of that before. So the point I'm trying to make is when you go for your regular routine follow-ups, which we all should do, make sure you're talking to your practitioner about what you're doing. Dr. Gibson was talking earlier about something very important, how Dr. Gibson is able. Now, y'all don't know, Dr. Gibson's super, super smart and a pharmacist extraordinaire. He can probably compound whatever he needs by himself and make it all balanced. At the same time, I'm not Dr. Gibson, and I'm not trying to do that because I don't have that level of expertise. I don't have Dr. Maxey's level of kidney expertise. So just be comfortable with what you know. Don't believe the people on TikTok who, the more you click, the more money they make from all the ads on their site, however all that stuff works. Make sure you have a trusted practitioner and make sure that person knows all the different things that you're doing to your body.
Good point. And let me bring up another point. You and Dr. Lawson talked about it before. If you're taking high blood pressure medicine, one of the reasons your blood pressure is controlled is because you consistently take it on a regular basis every day. Oh, my blood pressure is good today, I can skip it. No. The reason it stays controlled is because it lasts for 24 hours and you need to keep the levels in your body up. So take it unless you're symptomatic from your blood pressure being too low, which usually is very rare in most people unless you're dehydrated or some other reason. Continue to take your medicine. Don't change it without talking to your provider or the person who prescribes it. Very important. Follow the directions. Is that common sense? That's neighbor Stephen? Common sense? Take what you're supposed to take?
You would think.
So wait a minute now. Common sense ain't common, as Dr. Neighbor Stevens likes to remind us. And at the same time, our lifestyle might get in the way of some of the things we know we're supposed to do, right? So there are some medicines that if your doctor says take this twice a day, doesn't really matter that much what time you take it or how much time is between the medicine. And some medicines, you need to kind of split them up significantly. It needs to be like sometime between 6 and 8 in the morning, and then sometime between 7 and 8 at night. But find that out. Don't just take twice a day and go home. Say, well, I eat breakfast at 10 a.m. and I eat lunch at noon, so I'm going to take one at 10 a.m. and one at noon. That's not really usually okay for twice a day. So getting some notion about what your behavior should be when you get those instructions can make a difference. So if you don't know, your best person to ask about when to take your medicine is the person that's handing it to you, your pharmacist. When you get to the pharmacist will usually, oh, this is something that is time release. So get some time between dose 1 and dose number 2. All of that is important.
Let me bring this up to Dr. Hines and maybe even Simon. A lot of people believe in eating live food, not cooked food. So, you have any comments on that, Dr. Hines?
Did you say live food? What did he
You
say?
mean like live vegetables?
I
Yeah,
want my
so
food-
it's
I
or
want
raw
my food
food.
alive.
Yeah,
Raw
yeah.
food.
So
Yeah.
I've heard it more described as raw food, right?
Thank you.
Not crawling food like
No,
Oysters are alive.
I don't want the cow saying move.
we're not chasing down animals and taking a bite, right?
no.
So in general, I think if you're able to do it, sure, right? Like the premise is when you cook food, you cook away the nutrition, the nutrients. So the best way to do it would be to only eat things that are raw. And I only know this in the context of vegetarian veganism. I don't know it in any other context. I personally, the more power to you. I don't have the mental bandwidth to put that much continued and constant planning into my diet for myself. And remember, I've got young people, so that's just more than I can ask for. But it is a real thing. There are restaurants that especially in metropolitan areas, there are restaurants that are focusing on this. I think it'll probably be a fad like most other things. You remember how, just a few years ago, 5, 6 years ago, everything was about impossible meats and this, that, and the other. Now it's hardly even the shine came off that penny, and people don't even talk about it like they used to. Like many things, if you are willing to put that investment into, and great, right? And then I'm assuming if you were going to do that, then you would be focused on, organic foods and foods that didn't, versions that didn't have pesticides and all of those other things, because what would be the point if you didn't, take those other steps?
Dr. McJimmy just put in, no, actually, that's not true. There's some of us live in communities in which eating raw food is pretty consistent, especially in parts of North Carolina and others, some of the game animals. The other reason you cook food is to kill the parasites. So you got to know when the parasites are in the food and that sort of thing. But there's a lot of folks that eat game animals that are barely cooked. Certain kinds of sushi, certain kinds of beef, shredded beef that you eat, that is very, very alive. And also a lot of seafood that we eat is in fact still alive. So there are some communities, it's not a fad. It's been around for a long time and probably will continue to be around for the indefinite future, especially.
Do you mean that in the context of I only eat raw food?
No, Homo sapiens unique obviously other hominoids and others in that we are very we eat everything.
I was specifically
we
speaking.
eat a whole bunch of stuff. So it's in the context that we eat a lot of things. Depends on culture, depends on location, depends on availability. It's why Homo sapiens have survived, because literally we eat everything.
Yeah.
But
Oh yeah,
also
I was specifically speaking about the people who only do. There are some people who only do raw foods, but to the other, you made a really good point about the sushis and the other things that you were some carpaccio
Yeah,
or
also
whatever,
some game
tartars and all that
animals,
stuff. Yes,
well,
I was
also
really
eating,
speaking
worms and
specifically
so
about
forth.
the people who
Yeah, and also
follow
eating
an
rattlesnakes.
exclusive.
The
Okay.
last
Well,
point.
I have to look at my screen and recognize that my face was getting all twisted up when y'all talking about game meat and shooting things in the backyard and eating them. And look,
No,
no sushi, no uncooked anything.
Almost that time.
I don't do that.
hold on.
Okay,
I
miss
want to
me
make
with that.
one last comment. I made a trip to Fort Lauderdale to visit. Actually, I went to see Simon, and his mom made me a salad with raw carrots and is Simon on? It was one of the best things I've ever had. Nothing cooked, but all vegetables. Is
Yeah,
Simon
but
on
the
here?
carrots weren't live.
Yeah, I'm here.
What was that salad I had down there? It was so good.
I don't know. I had nothing to do with that. I like my food cooked, grilled, fried, sautéed, well done.
And I know it had sweet potatoes in it. It had
Oh, yeah.
carrot.
And if I overcook it and cook out some of the nutrients, I'll take a supplement to make up for it.
So come on.
We'll put yourself back on mute. Let's go to final comments, starting with Dr. Lawson.
That's why, again, I hate to go back to the raw food business, but some of us do, and a lot of us eat things called like coleslaw, which is alive when it was growing in the garden. But I also want to know that there are special populations. I make the point I've made before. What about the issues around, I'm sure Dr. Walker can say more about the issues around mental health and substance abusers, and especially in terms of access to primary care physicians, which many do not have, especially in terms of people who are chronic alcohol users, chronic drug abusers, who do fine first 10, 20 years of doing it, but as colleague Dr. Chapman will tell you, when he's supposed to get up into age, they have real problems. And a lot of what we were saying, we had to go overboard to make sure that they get an adequate diet, and some of them may need supplements to deal with these issues. And then I just want to throw into a rare phenomenon. I'm one of the few world experts on a phenomenon called water intoxication, which there can be another whole show in itself. But basically, people who are heavy alcohol users or who have severe mental illness literally die from drinking too much water. But that is an uncommon phenomenon for that have severe mental disorder.
And it's true. It's very true. Dr. Hines?
I think that we started talking about some of those risk factors and things you can do to make sure that your kidneys are well taken care of. And one of the things that stood out to me in the beginning was in those early stages, when you're in those stages 1 and 2, there's nothing to see on the outside, right? So you're going to have to engage with your primary care provider to be able to even detect some of those things. So just because you feel fine doesn't mean that everything is fine. So go ahead and make sure that, as we've talked about many times before, that you follow up on the recommendations that your primary care provider gives you to go get that lab work done, right? Because lots of times they give you the slip and then you're supposed to go somewhere and then it doesn't happen.
Thank you so much, Dr. Hines. Appreciate it. Dr. Walks.
Thank you, Dr. Maxey. One of the things that we didn't really jump on and talk about a lot today with respect to kidney damage is the non-steroidal. We talked about the athletes and alkaline water and what have you. Another challenge for athletes is that, you know, they'll bump something, they'll bruise something, they'll stretch something and pull something, and they run right to the Motrin. And if you're taking a whole lot of Motrin, yes, it's over the counter and you can take a lot of it, but your kidney doesn't like that. And so we have to be very, very careful about the other kinds of supplements, the over-the-counter pain medications that we take while we're out there getting our 150 minutes of exercise in every week. Just be careful about some of the other things that we do that can damage our kidney.
That's an extremely important point. And we tell people with pain, sometimes you use those gels, those pain gels on the outside, heating pads. I try to stay away from those NSAIDs. So heating pads work, icy hot works, all kind of stuff works. So you rub it on and not put it in your mouth. That's a very important point, Dr. Walks. That's Neighbor Stevens.
So I was on the same wavelength as Dr. Hines, but my point that I want us to punctuate is don't take your body for granted until you're 65 and think that's when you need to get a tune-up. You need to be conscious of how great the human body is and do whatever you can to sustain it, starting early.
Yeah.
Don't wait. And we're going to be talking about how a lot of the recommendations lately are being changed so that the intervention is being initiated at a younger age. So I just want to emphasize, don't wait. This is something we should be conscious of, investigate, incorporate into our lifestyle from the very beginning.
Thank you
Amen.
very much, Neighbor Sue. We are going to have a program coming up either next week or week after on the new guidelines for lipids and how you control your LDL and things like that. And one of our cardiology friends will help us with that. Thank you, everybody. Have a great, great day. We love everybody. And the message in church today, Dr. Walsh, was if you have living water, you'll never thirst again.
Love it.
Great.
Love it.
Have a great day, people. Thanks,
Bye.
Simon.
Everyone.